Yeah, you are so welcome to another episode of my channel. It is a great opportunity indeed for us to meet once again in order to continue from where we stop and dive into many topics that we have to cover. All right. Today I'll be talking about why does menstrual period cause pain. What triggered me to talk on this because one such a lady asked me of because she was menstruating and she said, "Why all this pain?" So I just want to answer the question. But the topic, is just like she's the one that asks. But I just want to answer her own question because for many people to learn and to know why it happens that way. But take note that it is a natural process in the body during this menstruation. There is no way you menstruate and you will not pass through these pains. But though the pains differs, all right. Follow me as we dive into this topic. Why does menstrual period? Because it's severe pain. Because this menstrual pain is also known as a dysmenorrhea. This occurs due to a natural processes in the body during menstruation. You understand? Because I will highlight some simple health education breakdown for you to understand more about this. But I will start with the cause, the causes of this menstrual pain. That is the cause menstrual pain. Number one, we have under it, we have during this menstruation, the uterus contract because when contracting, it helps shading its lining, that is the endometrium, which exit as a menstrual blood. And these contractions are triggered by some chemicals called prostaglandins, which are released in the uterus. Okay, because higher levels of these prostaglandins cause a stronger contractions. Stronger contraction will reduce blood flow to the uterine lining and increase sensitivity to pain, leading to some of the cramps that a woman or a woman pass through. Can you see one of the reasons? Can you see some of the reasons? All right, so let me just talk about some of the types um, of this menstrual pain. We have a primary dysmenorrhea because this menstrual or menstruation is the dysmenorrhea because shedding of those blood in the uterus. So number one, as I said earlier, is primary dysmenorrhea, common in younger women and caused by natural uterine contractions. And the secondary dysmenorrhea is often linked to underlying conditions such as the endometriosis and fibroids or a pelvic inflammatory disease, which is also known as a PID. Okay, so this it is a natural something. It is natural for a woman to pass through all this. But what would be the signs and symptoms of all this? Because there are people that are watching me. Some people will definitely know some of the symptoms, but there are some that perhaps they don't know. Some of these signs and symptoms is cramping pain, in the lower abdomen, pain radiating to the lower back and thighs, and nausea, fatigue, or headaches in some cases. Okay, so now, how can we just manage this menstrual pain? Many people have been asking me. They'll say, please send me, the name of the drug that I will buy in order to subside all the pains that I've been passing through. No, 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 no. Let me just highlight it free of charge without, paying anything. So, number one of it, yeah, medication. Medication because over-the-counter pain like ibuprofen reduce prostaglandin production because high level of these prostaglandins will now increase the crampness or the pains that a lady or a woman will pass through during menstruation. Then heat therapy, that is another method of managing this menstrual pain because applying a heating pad or warm water bottle to the lower abdomen relaxes muscles, and ease some cramps. Okay, so lifestyle changes also, like regularly exercising yourself, because regular exercise improves some blood flow and reduces some cramping or some cramp severity. Okay, because a healthy diet rich in fruits, vegetables, and omega-3 fatty acid also um, may help in terms of treating or managing this pain. You cannot treat it, but you can just manage it because it is a natural something. And the next one is hydration. Make sure that you are drinking plenty of water in order to reduce bloating and discomfort. Okay, but now, when are you going to seek a doctor, or when are you going to see a doctor? So now, if the period pain is actually severe, lasts longer than usual, or some interferes with a daily life, consult a healthy care provider in order to rule out some conditions like endometriosis or a fibroid. Okay, because because of this, I will give you something free of charge. I will advise. You see, this menstrual pain is normal to some extent, but it shouldn't prevent you from living your life, because many girls have been taking different types of drugs that will now cure that problem. It will manage it, but in other way around, it will now cause another problem that we don't know. But in the nearest future, that particular problem will manifest. So my own advice is a normal thing. Just know how you can just at least endure or persevere. But if the thing persists, at least you can take some pain reliefs in order to manage or subside some of the cramps you are passing through, or reduce the level of the prostaglandins, as I said earlier. And another advice that I would just want to give is, because understanding your body and tracking your symptoms can help you manage some of the discomfort effectively. Seek medical advice if pain become unmanageable, as early intervention can prevent some of the complications. Please and please, menstrual pain or menstruation is a natural process in the body during menstruation. I know many of you will ask me questions, but just feel free. Any question that you have, you can just put it at the comment section. When I'm ever ready, by the special grace of God, I will answer your question. Thank you, and continue to help me share. Don't be selfish, and you'll be learning without sharing with others. Please help me share with others so that they will learn and they will be improved in terms of health education. Thank you very much.